Simple
I think
stuff.
one little trick my dad, for years, he kind of famously kept just a standard cheap $2 egg timer on his desk and set it, I think, for every 20 or 30 minutes. And every 30 minutes, it would go off. And it just made him aware of, the fact that he was looking down for that long, and he would stand up and stretch his back and his neck and then sit back down.
That same idea has evolved into an app. Now they have an app on your phone. It's a little device that sticks to your back, and when it senses the change in your angle or your posture, it will vibrate or send you some type of alert, and it just kind of brings you back to the moment.
It's kind of funny sitting here talking about posture. I'm like becoming more aware of mine. Makes me feel like I need to sit up straight.
For
these chairs aren't real good for it.
For $20, you can get an exercise ball, and you can use that as your chair. That's really good.
Do you do that?
Mm-hmm. I do that when I have to sit and do paperwork. I have a big exercise ball. I sit on that. It's rounded.
It seems like it would be uncomfortable.
No, it actually forces you into good posture. I mean, you can't.
You ever fall off of that thing?
I have not, but I've come very close. That posture trainers, they're very inexpensive little straps that you can wear that will kind of give you a little nudge. And
yeah, I have one of those. Those actually work really well.
Yeah.
Actually, I think I got it from this chiropractor office down the street, Dr. Orr. So.
Yeah, $30, Amazon. I mean, come on. It's passive. You put it on, you forget about it, but it really keeps your posture up. Exercise ball, $20. So, I mean, very low tech, very, keep the expense down, keep it simple.
In a way, to me, it almost seems like you're talking about things that are common sense or perhaps should be. Are you ever surprised by the fact that you have to inform people that it's a good idea to be aware of their posture, or it's a good idea to not be looking down all day?
Well, pain is a good motivator. Most people don't get there until it hurts. And then all of a sudden it's like, okay, what am I doing? So we try to get, them thinking about it before they get to that level. A classic thing we see now is people have recliners or setups and they have a TV on the wall, but the TV is offset maybe 30 degrees to the right. And they don't realize every night they sit there, they're rotating their head, neck, and, their body to watch the TV. And it's repetitive, the same direction over and over and over. And over the course of time, that really leads to imbalances and problems. And it's like, just put the TV in front or move your chair. It's very simple, But until it starts to hurt, they don't think about it.
So it kind of sounds like, you're fixing people, but you're also kind of fixing lifestyles in a way. Do you feel like you need to get in there and fix somebody's lifestyle in order to really?
Well,
you said you get results. I know you get results. Is that what it takes, though? Is those lifestyle modifications to really make that happen?
Well, I think, like I said,
what's your secret sauce, Reuben? That's what I'm trying to get to.
Well, I think we all do it. I'm guilty of it myself sometimes. Mm-hmm. But, once you've been through a few episodes and you realize the impairment that it can cause and the disability and the pain and just basically, everything kind of stops when you have some situations that we see, and it's expensive, time off of work, treatment costs, things like that. So once you've been there a few times, you start to realize it's just easier just to prevent going there. It's better, it's cheaper, it's safer, and just why go there if you can prevent it? So we try to help them understand that they can prevent it most of the time.
Mm-hmm. So where our worlds oftentimes collide is in what we would call you and I both call in our practices the PI world, which is personal injury. I see a lot of people that have severe injuries. You see a lot of people that have severe injuries. A lot of those injuries occur typically either in a car wreck or some other traumatic event. What's the difference for you between treating or seeing a traumatic patient versus seeing somebody who has these repetitive injuries from lifestyle over time?
Well, I think the one thing that most of us are all exposed to regularly are car crashes, because we're all in our cars a lot. And nothing will change your body faster and more instantaneously than a car crash.
Yeah, humans are not designed for that.
Right. Yeah, we don't do well in those.
Yeah.
And that's instantly you're a different
We're made
person.
of Jell-O with like sticks inside. Like we're not meant to crash into things at 60 mile an hour.
Yeah, so that instantly changes everything. And I think a lot of people have a hard time just recovering from some of those injuries. Even once the pain is subsided, there could be long-term limitations and impairment that comes with that. So that's really unfortunate because, a lot of times it's just, it's just sad to see people get hurt and they get better, but they're never quite right again. Never get back to be the same person they were. And that can be pretty traumatic in other ways for a lot of people.
How do you document that? So when someone comes back, so let's think of a typical case. So prior to a wreck, somebody, maybe they're 50 years old. They're not at 100% compared to where they were when they were 20, but they get around pretty good. They can play golf, whatever the case is. They get in a wreck. Someone crashes into the back of their car at a stoplight at 50 mile an hour, say. They come to you with these neck and back injuries, and you get them from where they were after the wreck back to like 75 or 80% of where they were prior, which oftentimes or in many cases is a huge improvement, but they're not quite where they were. So how do you deal with that as a doctor? How do you document that?
Well, there's always, advanced imaging things we can do to really look deep and see the type of injuries and what structure, anatomically was injured. And we know from just, years of research and whatnot, how those things will respond to the injury and how they heal. Even in optimal situations, soft tissue injuries are just, they're permanent. We used to think that they were temporary, but now we understand that really is permanent. Scar tissue, adhesions, all that stuff comes with the injury. And that's just it's a permanent injury. We try to get optimal healing to where they get back to as close to what they were as possible. And a lot of times that means pain-free, no impairment, their range of motion, their abilities to do things are good. But really, if you get into it, they're not quite 100%. They're 99% is great. Unfortunately, some people never get back to even being pain-free. And those are really the disappointing cases that you see.
What are the typical injuries that you see after a car wreck?
Soft tissue strain, sprain. Most people will go to the ER, and the ER is the emergency.
When you say soft tissue, these are terms that you and I know. Yeah, okay, but explain what soft tissue means.
Soft tissue is basically, technically, is everything other than your bone. Organs are soft tissue, muscles, ligaments, tendons. But typically in a trauma case, we're talking about the muscle structure, tendons, the ligaments, the cartilage, things of that nature, the nerves, the disc, and the spine, the brain. Concussion symptoms are something we see a lot of, and the brain is soft tissue.
When someone comes to you, oftentimes it's after they've been to the hospital, after they've been through the ER, and then they come in. What are some typical undiagnosed injuries that you might see because someone might say, well, I went to the hospital, and they said, I should just wait a few months and then we'll see,
Well, the emergency room, I think, is emergency. I mean, if there's no life-threatening injuries, then technically you're not an emergency. I mean, you may have some injuries, but they're going to basically just check you over. If you're not going to die that night, then they're going to send you home with some short-term medication and instruct you to follow up somewhere else, which is pretty standard, and that's what we see typically. But I think there's a miscommunication. Patients go home and think, okay, well, I'm fine, I'm okay. But then, they're sitting there week by week and they're wondering, okay, well, if I'm okay, why am I feeling like this? I have my headaches, I can't turn my head, my neck hurts, I got tingling in my arm, like something's not right. And I think at that point they will initiate, reaching out to someone and saying, okay, something's not right. And that's when we get them. How
does someone typically find you? Where do most of your patients come from?
I think typically for us, just word of mouth.
Yeah.
Internal referrals. I mean, somebody at their church or at their work or the family member will say, hey,
you really need to go see this guy.
Just get checked out. And I encourage everyone to get checked out, even if they think it's minimal and it's not if they think they can just ride it out. A lot of times things will get better on their own, and there's not a lot of intervention that's absolutely necessary. But we see a lot of that later, 6 months later, when it didn't go well, and now it's a chronic issue. And we definitely hate to see that.
You mentioned earlier that